Vanakkam, good morning. In this video, we are going to discuss about the lung complaints. Lung complaints is the important short notes from the respiratory physiology. Complaints is the ability to expand the lung and thorax. Otherwise, we can explain as the stretchability of the lung and thorax is called as the complaints. We can measure the compliance by change in volume per unit change in the pressure. So we can express like this: change in volume per unit change in the pressure. We have to measure the volume. Volume is the V by pressure. It will give the value of the compliance. It measures the stiffness of the lungs. Compliance in relation to the intrapleural pressure. Compliance of the lung and thorax together is a 100 ml volume per 1 centimeter water pressure changes. The intrapleural changes 1 centimeter water, it will change the 100 ml in the lung and thorax together. In the lung alone, compliance of the lung alone is the 200 ml volume changes per 1 centimeter of the water intrapleural pressure. So 1 centimeter of the intrapleural pressure changes the 200 ml of the volume changes. So it will stretch the lung. Static compliance is one of the type of the compliance. Breathing does not take place in the static compliance. So we can record the static compliance during the breath holding. So more pressure is required to overcome the elastic resistance of the respiratory system. At the rest, the lung and thoracic wall try to collapse the lung. So it is the opposite effect of the complaint. So more pressure is required to act against the elastic resistance of the respiratory system. Dynamic complaints record during the breathing. During active breathing, we can record the dynamic complaints. So in the stiff lung, dynamic complaints is drastically decreases, but the static complaints, small changes occur on the static complaints and the stiff lung. For the measurement of the static complaints, volume of the air measured by the spirometer and intrapleural pressure is measured by the esophageal balloon. Simultaneously, we can record the both volume and pressure. We can depict in the graph. We can explain the static compliance. So this is the pressure volume curve or compliance curve. The x-axis depicts the intrapleural pressure. Y-axis is lung volume 0 to 500 ml. Tidal volume here. Intrapleural pressure during the inspiration from the 0 to the minus 4 centimeter water to minus 6. Each centimeter it moves more than 200 ml. Normal complaint. So the inspiration volume is increases like this. Inspiration is green color. Okay. So the inspiration compliance is against the elastic force of the lung and chest wall. During the inspiration, the surface tension is more, so the compliance is less. Okay, so see every centimeter the volume changes is comparatively less. Here 5 centimeter the volume is around 100. Okay, but in the here it is more. So during the expiration, the compliance is more compared to the inspiration, because during the inspiration, surface tension is more, surfactant is scatterly present inside the alveoli. So that is the one reason for the more less compliance during the inspiration, because more surface tension during the inspiration because of the surfactant is scatterly present. The alveoli is enlarged. Alveoli is during the inspiration, alveoli size is enlarged like this. See, suppose assume this is the alveoli during the inspiration. The red color is the surfactant. Surfactant is scatterly present. Scatterly present in the, this is a surfactant. Okay. So the scatterly present. So surface tension is more compared to the in expiration. During the expiration, what happened? During the expiration, surfactant is closely present. Closely present inside the alveoli. So surface tension is less. So compliance is more during the expiration, less during the inspiration. Okay, so the path is not same during the inspiration and expiration. Okay, so sometimes in the animal we can demonstrate the compliance in the with the saline. So during the saline, what happen? The compliance curve is entirely different. We can show with this, with the another dark color. So we can demonstrate the compliance. Saline, when you infuse the saline, it is come like this. Compliance. Compliance is increased when you infuse the saline into the lung in the animal when you recorded, because the saline contained lung. So we fill the lung with the we fill the lung with the saline. So air is completely absent here. So surface tension is completely eliminated. So it is produced like this. So in the saline lung contains the more compliance because no surface tension. So normal compliance curve is this: inspiration and expiration. Inspiration giving the less compliance due to the more surface tension. Expiration giving the more compliance because during the expiration the surfactants are very close and surface tension is less. What are the conditions? Increase and decreases the compliance. So increase in compliance occur in the physiological condition like old age. In the old age, elastic recoil is affected. So elastic recoil is opposite effect of the compliance. So compliance of the lung is increases, but the elastic recoil effect is affected due to the destruction of the elastic tissue in the old age. And pathological conditions like emphysema. So in the cigarette smokers, the elastic tissue affected, so stretchability is very high. So it is produce the more compliance. This is the pathological condition, emphysema. And the cigarette smoking affect the elastic fibers, recoiling fibers of the lung. So more stretching the lung. Okay. And decrease in compliance like fibrosis, pulmonary fibrosis of the lung tissue cannot stretch the lung, and paralysis of the respiratory muscles due to some diseases, and accumulation of the pleural fluid in the pleural effusion, and pneumothorax, accumulation of the air in the pleural cavity also decreases the compliance. Thank you for watching this video. If you like this video, share your friends. Those who are not subscribed to this channel, please subscribe. Thank you once again.